So our strike begins officially at 7 a.m. I know some of our nurses were already escorted out. Our evening nurses were escorted out of the hospital if they intended to strike.
What do you make of that?
We support the hospital's plans in trying to keep patients safe. We really hoped to not end up here today, but due to the lack of progress at the bargaining table, this is where we are today. So we understand keeping patients safe, but escorting, nurses out also seems a bit extreme.
24-hour strike. What do you hope comes out of this? Is this kind of a shot across the bow, if you will, sending them a message?
We definitely are sending a message. We hope that they see, some of the statements they've put out is that NNOC is a national organization pulling the strings. That is not true. Our union is us. We are the nurses of SLU. We are the ones making these choices. So this isn't us versus them. This is us versus us because we all are dedicated to the patients of SLU. So I definitely, our hope with one day is for them to realize how united we are as a union, as the core staff of SLU, that we are experts and that we want to get back in there and take care of our patients safely.
Yeah, Hadas, what's the biggest issue for you personally?
For me personally, I have two issues. One is workplace violence. I myself was assaulted in this hospital. They've got to do more to increase patient safety and staff safety. And then nurse recruitment and retention. In the last 2 years, they've hired 1,600 nurses, yet we have a 30% vacancy rate. They've hired enough nurses to staff this hospital twice over. The nurses just don't stay because of the ongoing working conditions. So we want better recruitment, better retention.
Maddie, what about you? What's your biggest issue?
Those are the same ones. Personally, for me, it's definitely staffing. We really need to get some experienced nurses into the hospital and keep them there. We're having this issue where we're getting in lots of new grads, lots of agency staff, which of course we appreciate our agency staff, but this is a teaching hospital and we need to be able to mentor the next generation of experts, and we aren't able to do that when people aren't sticking around.
Do you think you guys are having a different experience than, down 64 at St. Mary's or at Mercy, or because of the fact that you guys are a teaching hospital?
I can't really speak to that. I've never worked at Mercy. I just know that what we're focusing on right now here at SLU is the ability to recruit and retain nurses that stick around, and that we are giving them a place where they want to stay, and the current conditions aren't acceptable for most nurses, and that's why nobody's staying. Like Hadas said, they've hired 1,600 nurses in the last 2 years, but we have a 30% vacancy rate, so there's something wrong.
So those nurses are putting in their time here and moving on?
Yes.
That safety issue and security, that's a big issue these days. People in public positions like yourselves find yourself at risk more and more frequently.
Yes, workplace violence is a problem at SLU, and again, a lot of that does boil down to not having adequate staffing because, Hadas works in the ER, and if there's people waiting in the emergency room, waiting room for too long to seek care, they understandably will lash out, and unfortunately the people who get caught in the brunt of that are the nurses. If someone upstairs on the floor is waiting for pain medication, they're waiting for their nurse, they need to help, to get up and use the restroom, and the nurse isn't available, they lash out, their family members lash out, and it's not acceptable, but we can see why this is happening. It's just because we don't have enough nurses to go around and make sure that everybody has their issues addressed in a timely manner.
Right, but beyond just, people upset with having to wait, you guys are facing criminals here, you're facing people under arrest, you're facing mental illness.
We are prepared to take care of anybody here. We don't discriminate against somebody who, is incarcerated or anything like that. I don't know that the person necessarily is violent because of who they are. What we're dealing with more is patients who are just frustrated and upset and lashing out.